Hi, my name's Denise. I'm going to be your nurse today. Can you tell me what your name is?
My name's Tyler.
And how old are you, Tyler?
I'm 15.
All right, Tyler, you're in for an abdominal assessment today. If you have any questions, just let me know. I will be doing what we call palpation, which is touching your abdomen. If you feel any tenderness at any time, you let me know, okay? All right. First of all, we're going to start by inspecting. I'm going to get down at eye level. I'm looking at your contour, the shape of your abdomen. I'm looking for color, scars, striae. Your umbilicus is nice in midline, and I don't see any pulsations or visible peristalsis. All right, next thing we're going to do is going to listen to your bowel sounds. We're just going to be listening to several different spots. Doesn't mean anything's wrong. Good. All right, Tyler, now we're going to be listening with the bell of the stethoscope, which is the small part. We're going to be listening to some vascular sounds, okay? So this is your aortic, renal, iliac crest, and femoral. Good. Okay, any tenderness there? All right, now I'm going to do some general percussions. Excellent. Okay, now I'm going to do some light palpations. Okay, any tenderness? Now we're going a little bit deeper. All right, any tenderness there? Okay, now I'm going to be checking for some organ swelling. So if you will move your arm to the side, first of all, I'm going to palpate your liver. I'm going to just lift you up here underneath your rib cage. Take a big deep breath for me. Great. Okay, now we're going to do the same thing with your spleen. I'm going to lift you up. Any tenderness there? No. Okay, now I'm going to feel for your kidneys. Okay there? All right there? Okay, now I'm going to do what we call some specialty tests. I'm going to be checking for your gallbladder, which is called a Murphy's test. Okay. I need you to take a big deep breath. Any tenderness? Okay, good. All right. Then I'm going to be checking for your McBurney's point. So I'm going to push in. Any tenderness? No. Okay, what about when I pull back? Okay. Now I'm going to be checking for a Bloomberg's test. Pushing in here. Any tenderness? No. What about when I let go? No. No? Okay. So this was checking for appendicitis. This was also checking for appendicitis or any kind of rebound pain, okay? Now another test that we're going to be doing is called an iliopsoas. It's also checking for appendicitis. So I need you to lift your leg for me. Excellent. You're going and lift this leg also. Excellent. Any pain or tenderness in there? Okay. I need you to sit up for me. Just turn to the side this way. Yes, we're going to be checking CVA tenderness, which is checking for your kidney. Any tenderness when I hit? No. Excellent. Okay, Tyler, you can turn back around. That includes your abdominal assessment. Any questions? No, ma'am. Okay, I'm going to do a report for a 15-year-old male that came in just for an abdominal assessment. Started off with inspection at eye level. Abdomen was nice and flat. Color was appropriate for his race. No scars or striae. It was nice and symmetrical. There was umbilicus was midline. There were no visible pulsations or peristalsis. Then we moved on to his bowel sounds were present in all four quadrants. Vascular sounds noted at the aortic, the renal, iliac, and the femoral without any thrills. They were also assessed with the bell. We did general percussion with resonance and tympani heard. CVA tenderness was negative. Negative to tenderness to light and deep palpation. Unable to palpate liver, spleen, or kidneys, denies any tenderness. Specialty test with a negative Murphy's, negative Bloomberg's, negative McBurney's point, and negative iliopsoas.